Next we move to Sean Dougherty of the OECD, where he's advised governments for over 20 years. He leads the Secretariat of the Network on Fiscal Relations across levels of government and is currently supporting efforts to apply AI in public finance. He has published widely on fiscal federalism, productivity growth and economic development. He holds a PhD from the Paris School of Economics and has previously studied at the University of Pennsylvania and MIT. Today he's going to talk to us about aging and AI, rethinking fiscal pressures. So thanks very much, Sean.
Thank you very much. It's a pleasure to be here. It's a lovely space and looks like a very interesting discussion today. And I saw quite already very interesting topics that the OECD is deeply involved in. I'm going to focus on one particular angle today, which is, I think, the challenges from aging. We published a paper on this a few years back, including a deep dive on the Irish economy and Irish demographics, also adjusting for some of the peculiarities of the Irish economy in terms of using GNI, given some of the issues we just heard about in the previous presentation. I'll also integrate some of our thinking about AI. It's, I would say, more speculative and more illustrative. At the same time, I think we already have some pretty good early evidence on a micro level on what the types of impacts might be at a task level. Of course, going from tasks to macroeconomic and longer-term impacts is perhaps a leap of faith. There's even a bit of controversy inside the OECD about what these impacts may be. There's all sorts of, I would say, general equilibrium questions. There's technological questions. There's, I would say, the speed of integration and adoption. And I think there's a broad consensus that the AI era is something that we've never really seen before. You've heard of GPTs, but probably it's a different GPT than the economist version of a GPT. That's which we call a general purpose technology as economists, but it's also, just a tool from ChatGPT, from OpenAI. But this is only pretty much 2 years old, but at the same time, we see some pretty transformative effects. And in our network, we've been starting to think about what the impact might be on public finances in particular. And I think a lot of the early impact has probably been in the private sector and adoption and coding and some sort of low-hanging fruit type tasks. But we see a lot of potential, particularly in the area of healthcare, which integrates and directly affects the aging-related fiscal concerns. Let me just start. There's certainly a fiscal tension with rising pension and healthcare costs in all OECD economies, and including in Ireland's. At the same time, workforce growth with aging tends to be declining. If we integrate AI into this, we see an AI productivity shock. It can go a couple of different directions. I'll mention even some concerns where it might even increase costs because it also advances the potential for longevity, for instance, and investing in health-raising technologies. Of course, there's potential for looking at even a very broad range of tasks. I mean, I'll actually look at it in a pretty narrow sense and just boosting administrative tasks and see that the potential is already tremendous in terms of reducing some of the fiscal pressures. And I'll say a little bit about the Irish laboratory, not with too much depth, because it's a few years out of date, our analysis, but I think it's important to look at your own demographic context, which in many ways is quite promising and much better than a typical OECD country, because you still have a younger population, even if there's probably a fiscal cliff out there in the distance. We've done some recent work in the economics department at the OECD on the fiscal landscape and looking at where spending may be, I'd say, where pressures interact directly with demographics. And certainly old age is perhaps the biggest broad risk for spending, and including on social protection as well as education. These are all like very high risks towards the future as we think about extending lifespan and trying to increase the longevity of the workforce. And if we think about that, we looked directly at healthcare spending pressures in a series of studies, and the OECD has a healthcare model that looks at pressures, technological advancement. And what I think is also interesting to think about is, in general, in the past, pre-AI, a lot of the technological risk from aging was actually a cost increasing risk. So sort of as you see potential for longevity-enhancing technologies, these were often very expensive technologies, and they often tend to not only increase the level, but also increase even the growth rate of expenditure. So we would often include a kind of resilient scenario, which was like new innovations in healthcare potentially increasing the fiscal pressure through costs. But we do see, I would say, the opposite with AI, which is, I think, quite promising. That's not a given, because it may well lead to costly technological breakthroughs which may, substantially increase lifespan and change the whole risk profile. But if we look at it in sort of the things that we can see in the nearer term horizon, I think it's fairly promising. There are also some concerns, and I think there's a sort of economic compositional concerns, as a lot of the low-hanging fruits in adopting new technologies, in particular AI and automation-enhancing type technologies, including robotics, are probably in the manufacturing sector. And this is sort of the goods sector. And this often actually has what we call a Baumol effect in terms of increasing costs of services, which then can cause a change in the composition of the economy, which can be quite costly and diminish the overall rate of productivity growth. So that kind of mix, I would say, diminutes somewhat the potential for the upside, but not entirely. And I think if we look in a little bit more of a deep dive in healthcare and education, we see also some potential for increasing productivity there directly, particularly in the area of administrative type tasks, which can be a very large share of that work. Not to say that there isn't also vast potential increasing the quality of doctors' care or radiology, where we have a lot of evidence, but in some ways we haven't quite seen that yet. It's just more of like potential. But on the administrative task side, actually we have pretty hard evidence that you can do a lot of this billing in an automated way. You just throw it at an LLM. Maybe that's a little bit of an overstatement, but there are a lot of, I would say, proof positive tasks that can be automated quite well. The OECD has also done some broad macroeconomic work on the impact of AI. In fact, it's replicated Darren Esameglu's well-known study from last year, and in fact just did a few tweaks, looked at inter-industry spillovers and positive effects through, let's say, for instance, finance being enhanced through AI and then benefiting healthcare and education and other sectors. And in fact, those cross-industry effects increase the impact tremendously. It goes from the sort of very tiny red bar to the much bigger dark red bar. And then if you, I would say, incorporate slightly more optimistic views about the impact on the micro level in particular industries, you can almost double that effect. Again, it's still fairly conservative relative to some of the McKinseys of the world and the Goldman Sachs, but it's still quite a major potential impact on productivity growth in the range of 1%, which would be at least as big as the ICT boom of the mid-1990s. And so I think that we see some pretty substantial potential upsides. This is, I would say, that's across all industries, and so specific sectors, to be honest, including healthcare, may well have more positive upsides than that sort of overall scenario, which includes some fairly, I'd say, human-intensive industries, which may not necessarily have quite as high a productivity growth potential. There's also some ongoing work at the OECD looking at the potential directly for task-based adoption and aging specifically, and sort of expending working lives. There's, I think, interesting and promising work to suggest that people may actually be able to phase out retirement more gradually by incorporating AI into some of their tasks, because we often find, I don't know if you've heard about the paper, the Canaries in the Coal Mine paper. It's quite a well-known paper in Silicon Valley now, which basically shows that younger workers probably are suffering already. You saw the productivity growth release just early, well, the job release earlier this week, and when FT, Eric Brierson argues quite strongly, and I think fairly persuasively, that the rate of productivity growth may well have doubled implicitly from that drop in jobs, because actually GDP is quite stable in the US, but the number of jobs dropped by almost 1 million. So it's a big shift. If it goes forward like that, it's even bigger than the impacts that we were talking about. And then, well, if you sort of project that a little bit more broadly, we do see, Ireland has a younger demographic base, and I would say a skill composition that seems to be fairly well augmentable by AI. So some tasks seem to be more readily enhanced, others more substituted. So this is part of the risk profile. older workers actually tend to have more experience, more judgment, and actually, in many cases, can actually be better augmented by AI. So this is one of the interesting new findings in some of this literature. If we just look at the demographic profile of Ireland, I think you know this quite well. At the moment, quite a young population relative to most OECD countries, but also aging in the not too distant horizon, which is certainly a risk. And we think about healthcare costs and shifting of the overall workforce. And we need to think about both the cost side as well as the revenue side. When we did healthcare projection estimates, in terms of healthcare spending, we had a couple of different scenarios. At the moment, we saw spending increasing at about 8%, 8.5% per year. We had a more resilient scenario, and this is actually sort of including some basic technological advances that would be still cost pressure, but a few more percentage points per year in terms of spending growth as a share of GNI. But still, I mean, a very large share of government expenditure. But then we also had a pessimistic scenario, which was sort of a decline in the quality of health and perhaps some slowing adoption of new preventative type technologies. And the risk scenario is quite a bit heavier, probably a doubling of that overall fiscal burden in terms of expenditure. So a pretty wide range of potential risks in terms of the potential spending burden. And then as we sort of look at the demographic profile and a little bit of a sort of a snapshot picture, as this population bulge retires, we see a shift from net contributors to net beneficiaries, and this is sort of the fiscal cliff type risk. This is fairly illustrative in terms just to show the potential risk as population ages. And this is assuming current capacity for working and retirement ages. And the tax base, despite it being quite buoyant in Ireland, in fact, our estimates suggest that Ireland's tax base is actually the most buoyant of the OECD, and that probably reflects a pretty heavy reliance on corporate and asset-based taxes as opposed to pure labor taxation. But it's not buoyant enough to fund this shift, so it's still a pretty major burden. But if you look at a country like Japan, it's quite a bit heavier. It's even hard to imagine how they can finance it under current expectations. So, when we tried to look a little bit more deeper at AI bending the cost curve, we looked a little bit at Ireland, but it's based actually on Spanish, very detailed data. But it was meant to be illustrative about what the potential task level mapping within the healthcare sector might be, and we tried to come up with an AI-augmented fiscal projection. And there, we saw savings quite tremendous of as much as about a quarter of current healthcare costs. Now, how quickly that could be incorporated is a question, but this is a fairly simple assumptions of in the current expenditure pattern, task-based application of essentially operational administrative tasks, things like note-taking, billing, things that we know can be done very well by LLMs and related AI technologies, and basically allow for tremendous cost savings on that side, and allowing doctors to essentially just do more of their time in medicine, and other types of clinical practitioners to spend more time not doing those administrative tasks which reduce their overall effectiveness. And that's not even incorporating, I would say, the potential enhancement of the doctor's ability and nurses and support practitioners to be able to deliver healthcare more effectively and perhaps with higher quality outcomes, and certainly not even incorporating some of the technological advances that we see, such as the single ingredient from Indiana that also enhances, there's some evidence that may even enhance lifespan. So that's the longevity drug, as some people are talking about, but I don't know if the evidence is quite strong on that yet. But we definitely see a little bit of an inversion in the US life expectancy, which is fairly promising. It may be conditional on high obesity rates, but nevertheless, it's quite promising. So anyway, when I showed this to my colleagues, they were a little bit shocked by the wedge size there. So I'm going to say it's illustrative. It's not a very specific wedge, but just to show that even a fairly, I mean, one quarter of a spending is huge, of course. So if you think about that kind of something on that order of magnitude, even over, let's say, a 10-year period, it could really control costs in a massive way, and so it changes the inflection point from something that's almost unsustainable to something that's quite a bit more easy to absorb through the tax system. And well, if we look at the buoyancy of the current tax structure in Ireland, it's quite promising actually. We see an increase of quite a big increase in the overall potential for increases in revenues to potentially cover some of these costs. There's also some, I would say, some interesting issues that come up as you start to improve efficiency of healthcare through, for instance, AI. The unit cost of care drops, but this may well, there's a question, you could assume that the cost structure stays fixed, that you just save that money and you keep delivering the same quality of care. Now, you can imagine in a real world, there's a political economy, people will want to actually spend more on healthcare because there's that savings. So there's a question about how do you reallocate that savings, and do you invest more in life-extending technologies, health-improving technologies? And then there's also, I would say, a broader issue about the overall saturation of demand. I'm not going to take any strong position on this, but just to say that there's a real question about even a big breakthrough. Let's say if you were to have a quarter reduction in the cost of healthcare at the 10-year horizon, that's kind of a partial equilibrium result. In a general equilibrium framework, you might think about, well, perhaps half of that would be spent on life-enhancing technologies, perhaps half of it would be a cost savings. Anyway, that's just a kind of back-of-the-envelope suggestion for how you might think about that. Perhaps even there might be pressure to actually spend it all on life-extending technologies, so then maybe but not have any fiscal savings. But there may be important issues about trying to incorporate incentives into the healthcare system that at least manages to make the whole system more sustainable over time. So just a couple of policy suggestions. I think I already sort of mentioned them implicitly with the overall revenue base, and these are broad brush, but just to suggest that I mentioned that Ireland's tax base from our sort of buoyancy estimates suggest that it is perhaps the most buoyant with respect to GDP over time. That's partially related to the demographic profile, but also to the tax structure. And this is a stronger reliance on asset type bases than in a typical OECD country. We would, I would say cautiously suggest that kind of a shift. I would say that there's a bit of debate even inside the OECD about whether you should shift away from labor taxation or not. But labor taxation, depending on how it's structured, whether pensions are taxed, for instance, there's a real question about whether it's sustainable as you have rapid aging and you start to face a decline in the average, the working population. Certainly, consumption taxes tend to be much more buoyant, and we also find that corporate taxes as well. Second is sort of healthcare type recommendations. I can think about, trying to roll out AI into different phases of the different parts of the healthcare system. You could focus initially, even going beyond these kind of operational, administrative type costs, and thinking about helping with care integration and digital twins and prevention and healthy lifestyles. Healthcare advisors through devices that could be helped to use predictive analytics to target preventative care and improve the quality of overall healthcare. And well, we see a real window of opportunity. I mean, I think this is the whole AI era is coming fast and furious, and I think it's promising, but it's changing many things in many sectors. I think the initial effects seem to be more on the private sector side, but well, my program at least is trying to help governments to think about how they could, not fall behind on the bandwagon and really think about applying these tools and rolling them out as quickly as possible where they're safe and may be highly effective in large areas of expenditure, with healthcare being pretty much the largest big elephant in the room. And Ireland's not different than that, and perhaps with its demographic future, it maybe still has time to make some good adjustments and adopt technology in a way that could really help to control the overall fiscal pressures in this area. Well, here's the sort of 5 studies that I used. A couple of them one of them was called Funding the Future. Another one was a deep dive study on Ireland, a piece we did on potential efficiency gains with AI, and some recent work on government spending and boosting adoption on aging societies. Sure.